She's an assistant professor at Department of Clinical Diagnostic and Therapeutic Science. She has been our clinical education coordinator for radiation therapy education. Her today will be discussing on this virtual environment radiation therapy program.
Good afternoon. I guess I'm last but not least today. So I do have a video to show, which will wake everyone up maybe. I'm sitting for so long. So thank you for the opportunity. So today I'm discussing something that we have had for student use for several years. And we have learned that there are other ways to use the system other than for student education. So today, I'm gonna go ahead and advance my slide. So the objectives are to recall, kind of look at the current patient education processes, and then identify challenges of patient education, which you're probably all familiar with. And then looking at what we can do with a VERT system without actually having the room accessible, which would be ideal for this. And then looking at what we could do in the future for patient education. So currently in Nebraska medicine, I'm assuming this is pretty standard across other centers. The main focus of patient education seems to be side effects. And the patients do need to know what they will expect and how they will be managed. They're given this information. They're often overloaded with information in one given time frame. And they walk away and they don't really know how to process the information. And also in terms of technical explanations, it's my understanding that each physician kind of has their own method of explaining radiation beams, you know, what the room looks like. Oftentimes patients want to have a tour of the room just to get some idea of what they'll be undergoing. And so with that, there are ways that we can show what the technical piece is other than just giving a verbal explanation. So probably the biggest challenge is low health literacy with patient education. Low reading levels are associated with noncompliance and also poor self-care. And they're also associated with higher rates of hospitalization and emergency care. Many patients, in fact, some studies say up to 60% of patients will turn to the internet once they're diagnosed. And a large percentage say that they feel that what they find online is just as good or better than what they hear in the physician office. And the average American reads at about the 7th to 8th grade level. And unfortunately, a lot of the published websites contain information written at a higher level. The NIH and AMA advise that information be tailored to a 3rd to 7th grade level. A study that I have acknowledged here, published in the International Journal of Radiation Oncology, Biology, Physics, evaluated 135 articles written for patients. Only one was written at an appropriate level. And so thinking about the information we're trying to provide to patients in terms of side effects, the disease process, but then the technical piece, radiation oncology procedures are often difficult for patients to understand. And so the use of virtual education and video education is becoming really important. So this is an image taken from our virtual room. So it stands for Virtual Environment Radiation Therapy. It is now located in the library that's being remodeled. It's on the 6th floor. We just moved 2 floors down. We use it for radiation therapy student education, primarily in that first semester, during their clinical rotations and before they go to clinical rotations. It provides a safe, non-pressured environment for the students to practice patient positioning, which reduces Linac time required for training. The students are able to master hand pendants, as well as simulated couch controls, learn dosimetric principles, simulate misalignment, animate beam delivery, illustrate dose to target, and also practice with cone beam CT matching. So while the VERT's primary use is for student education, There are benefits to using it for patients due to these rich visual displays that we have available. It's an engaging tool that can demonstrate the therapy to patients and families in a less technical or threatening way. It gives the patients more time to process and understand what's going to happen to them before they start day one. And with our system, there are patient modules that are non-threatening. They don't have any anatomy associated with them. They're just patients laying on a table, almost like a cartoon version. And those are very helpful for someone who wants to understand but not maybe see their own anatomy. There are other ways of showing the patient's actual anatomy through this system or another system called Pearl. The ultimate goal, again, is to enhance their knowledge and improve a visual experience, and it might be better than the verbal that we normally give them. So our most recent experience with actually bringing patients to our vert room occurred over a time frame of probably 2 years, maybe 1 to 2 years. We brought pediatric patients and their caregivers to our virtual room. As part of a study that we conducted, we collaborated with Child Life and Hematology Oncology to provide, again, that non-threatening experience for the kids and the parents to show them the linear accelerator prior to starting treatment. The ultimate goal was to reduce the use of anesthesia. We brought them to the room, and these are actually my kids, so this is not a HIPAA violation. And so my kids did what every kid did that we brought them to the room. They moved the cartoon person up into the gantry, so that was a popular thing with the kids. We found that the older kids seemed to really enjoy manipulating the pendant and the table. The younger kids seemed to want to play with toys while we talked to mom and dad. But it really was a positive experience. It was difficult to obtain surveys because we were trying to get 3 surveys from the child, if they were old enough, and the caregiver. And it just became too hard to follow up. Oftentimes they would start treatment earlier than we anticipated, and we didn't get that other survey in. And so we did end up stopping this research. But during the time we did it, the parents really appreciated, I think, being able to see radiation beams, knowing where it was coming from, knowing how high their child was going to be on the table, just all those things that they didn't really understand. And then Child Life was very helpful in this, and that they would be off with the younger children while we were doing our parts. Another issue with this was the distance from the cancer center to our room. It was quite the walk. We were actually, one experience, we were bringing a child with mom and dad. Dad was an amputee, and we were trucking up 42nd Street to the library. So that was not ideal. Something probably mobile might be more ideal, that we could do real time with the patient versus having them actually have to walk that far. And so again, this is what we can demonstrate in the room. We can show all the different types of machines. So generally we'll show the TrueBeam because that's what we have here. We can also show Elekta and other varying machines, as well as a Siemens machine. Another way that we can use VERT without actually bringing people to the room is to include some of these images that we can create in a video. And some of you have seen this. We showed this to head and neck cancer patients over a 3-year time frame and ended up getting 78 as our sample size. And we randomized them. So we had some of the patients watched this video and then filled out a second survey. It was a pre-post design. And then some patients just received the standard education. And so I'm going to show you this video. Hopefully it plays. It's about 5 minutes. I can turn it down. So that was very well received by the patients that watched it. A lot of them didn't know how a mask was made. So they were able to at least feel more prepared. We were measuring anxiety with that study, which we found some differences between the control and intervention groups, but decreasing anxiety is difficult to do. So, I mean, we definitely want to do more with this going forward. Previous research with VERT has been published. A lot of this research that's out there has been done in the last 5 years. A lot of it has been with patient satisfaction, which is what we're all going for, and knowledge, perceived knowledge about their anatomy, and also about the reason for having a full bladder and an empty rectum for prostate patients. And prostate and breast have been the most studied, utilizing VERT. There are some studies out there too that were just in general cancer patient satisfaction. I think that there's value for anybody to have this. The first one listed there was actually in Australia, and they had a sample size of 19. The last one was 22. So they were all fairly small sample sizes, but with the numbers that are normally in our clinic, I mean, especially prostate patients, we could accrue pretty easily. So that's one of the things that we were thinking about in terms of the aging population and the number of prostate patients is looking at either breast or prostate going forward, and how we could use the VERT for education. So while the goal is to improve online readability, video education has been shown to be equally, if not more effective. So we can show pretty much anything with the system to help the patient understand the rationale for why we're asking them to do what we're asking them to do. The image on the left, again, is one of those patient cartoon modules that came with the system that, we can just show where the radiation is directed in terms of, this is safe. We're not radiating your whole body. It's very, very precise, all of those things to ease fear. And it has been proven that it does reduce anxiety just by showing patients what exactly will happen, because they can't see radiation beams and they don't know where it's going. This is my favorite because we use this for student education when we're showing the different types of plans and how much better the ARC therapy is than, for certain treatments and the other treatments. So this is, this would be great for patient education. And even if it wasn't their own plan, it would help them understand the anatomy and why we're doing what we're doing. I think that is all I have.